Hi, I'm Dr. Jim Downs. I want to personally invite you to come out and spend some time with us here in Salt Lake at the Dr. Dick Barnes Group. A dentist should consider absolutely to do the hands-on course. Here's the reason. You can sit there and you can go to many continuing education courses and attempt to go back to your practice and apply it. And here's the reality. You don't. The hands-on requires you to do it. It gives you the certainty, it gives you the safety of knowing that you're going to have some support there. You're going to have your master teacher standing over your shoulder, and if we need to, hold your hands. What we're going to put you through is a number of different steps. First, we're going to show you how to take proper photography. We're going to have you take the photography. Your staff can take the photography. We're going to then analyze the photography. And then we're going to start looking at your case presentation of how it was set up. We're going to look at every part of it. We're going to look at the prep styles, the prep techniques, the sequencing. We're going to go through the whole enchilada, and which means that you're going to do every step. And after that, then how to provisionalize this, how to stabilize it in the interim so that the restorations being done by the lab are done in an orderly fashion and yet the patient's comfortable. How to handle complications during that phase. What happens if something goes on in that whole process. And then the last thing is then follow through. How to have these patients back and to do what we call 48-hour return. And to learn from the patient. Is this the right formula for their proportions for their teeth? Is it the right shade? Is this the right look? Is the phonetics right? These are things that you don't think about, and there's more and more that go along with that. Now, when you return for the bonding, this is a process that really scares a lot of dentists. To have to put in that many teeth. What we're going to show you is how you can systematically and simply place these in a very orderly fashion, having your staff helping you doctors with this and giving them the experience and the expertise to help you fortify these restorations in the mouth so that the outcome that we want out of this is that they don't come off and they don't hurt the patient. They look gorgeous, they're dazzling, and then we do the follow-up, learning how to diagnose correctly the proper sequencing for adjusting porcelain and using technology that will help us, without a doubt, correct this so that you're not having patients come back with fractured or broken restorations. What you're going to experience when you come to this course is a number of things. One is you're going to be with your staff member. Your staff needs it and wants to believe in the doctor. They are a vital part of this whole process and how to take this back to your environment called your dental office. And so what your staff is going to also get out of this is how they should be properly positioning themselves, how to use the materials, how to even increase their help in helping you achieve this outcome. And that's exciting when we can see doctors all of a sudden prep the second half of the arch in half the time than they did on the first side. The amazing part that happens out of this hands-on course is this phenomenal transformation of the doctor. They totally believe in themselves that they can do it now.
He mentored me through that, and at the end we were kind of all getting tired, and I asked him, I said, well, maybe my girls would like to see you prep because you prep so much faster, because I thought, well, hell, we just finally get out of here. And he looked at me, put his hand on my shoulder, he says, you know, if I do that, you won't get the satisfaction out of knowing that you did all this yourself. And that was a game changer for me.